We're joined now by Dr. Joshua Sharfstein from the Johns Hopkins Bloomberg School of Public Health. Can you tell us a little bit about the Bloomberg American Health Initiative?
Sure. This is an effort to improve health in the United States through public health education, research, and practice. It's based at our school, the Johns Hopkins Bloomberg School of Public Health, and it was supported by a $300 million gift from Michael Bloomberg and Bloomberg Philanthropies. We focus on 5 areas: addiction and overdose, violence, environmental challenges, obesity in the food system, and adolescent health. And for each of those, we offer full scholarships to people who are working on the front lines of the issue. We do research to try to find new solutions, and we're out across the country helping the public sector, the private sector, develop new ways to make progress on these major issues, which are really fundamental to health in the United States.
That's wonderful. Can you tell us about your new partnership with the APHA and what you hope to accomplish?
Well, we have many partners with the Bloomberg American Health Initiative. We work with schools of public health around the country. We work with state and local health departments. A lot of them are sending their staff to be trained, and the staff can do that either full-time in Baltimore or part-time where they are while they're still working for, say, the Tennessee Health Department or the Philadelphia Health Department. And then with APHA, we're really hoping to have a major presence in Washington, D.C. APHA is just such a great organization, and it is really touching many different sectors. They work with the criminal justice sector on criminal justice reform. They work with law enforcement on gun violence. They are working with many different kinds of organizations on food and obesity. And so on all of our issues, APHA already has a footprint, and our goal is to work together to amplify our impact. So I'll give you a specific example. In September, we teamed up with APHA to host a gun violence policies that work session at the museum. We flew in faculty and experts from around the country to give short presentations. What works? What's the evidence? And we've been using that information to really spread the word on Capitol Hill and beyond.
And APHA has the challenge of creating the healthiest nation in one generation. What are the steps to achieve that?
That is a very ambitious goal. I'm fully supportive, but let's be honest, life expectancy has been declining for 3 years, which is the first time that has happened since the time of World War I and the Great Influenza. And the United States, by most projections, is headed to somewhere like 60th in the world in life expectancy. So health is not trending in the right direction. So what would it take to accomplish APHA's goal of making a lot of progress in one generation? And the answer is it would take a lot. It's going to take new policies, it's going to take a greater respect for public health, it's going to take new evidence to identify different ways of making people healthier, and it's going to take a commitment from both the public and private sector to prioritize health and the many things that contribute to good health, not just in the healthcare system, but in many different sectors.
And can you also tell us a little bit about the sessions that you're presenting in and what you see as the big issues in public health going into the 2020 election?
Sure. I'm presenting on a session that has to do with social justice issues in the election. And my assignment for that session is to focus on the opioid epidemic and what's at stake in this election. And you might think, well, they're both Democrats and Republicans who are talking about the opioid epidemic, so right, maybe everybody agrees. But once you get past just sort of the general statements that people make, there are actually a lot of different tough issues that are going to be on the ballot in 2020. So for example, people have very different views of criminal justice reform. Some people really want to focus on keeping people who use drugs out of jail. And there's a lot of evidence for doing that. Other people seem to want to restart the war on drugs, turn every overdose into a crime scene, and charge people who are using drugs with each other. And I would say there's not a lot of evidence for that approach. That would be one example. There are very divergent views on harm reduction. There are people running for office in local offices, for example, who are trying to shut down syringe services programs, even though there's a huge amount of evidence that they reduce the risk of HIV and provide an opportunity for people to get into drug treatment. So I'll be talking about the things that really are on the ballot with respect to the opioid crisis.
Dr. Sharfstein, thank you so much for providing us with all of this valuable information and joining us here today.
Thank you.